Hey doc, why does it hurt? Appendicitis. Appendicitis usually presents with pain in the lower right abdomen, with more than half of the patients experiencing discomfort before a more severe and localized pain. Other symptoms can include loss of appetite, nausea, vomiting, and a low-grade fever. Appendicitis, more specifically acute appendicitis, is diagnosed in about 5% of the population and most common among people between the age of 20 and 30 years old. But what is appendicitis? Appendicitis is an inflammation of the appendix, as can be understood from its name. The appendix is a small tubular organ in the right lower abdomen attached to the colon. It has no known purpose. Inflammation of the appendix is usually caused by an infection, a tumor, or the accumulation of calcified feces in the appendix. We also classify appendicitis as complicated if the appendix has not ruptured, and complicated if the appendix ruptures, which results in a widespread infection in the abdominal cavity. Diagnosis of this illness is based on the patient's history, as well as a physical exam and information in the blood draw, such as a high white blood cell count. Imaging is also very informative, specifically CT scans of the abdomen being the most common form of imaging used to diagnose acute appendicitis. Abdominal ultrasound can also be used and is helpful to avoid radiation exposure in children or pregnant patients. Treatment varies depending on the severity and complication of the appendicitis. In acute, uncomplicated appendicitis, the most common treatment is laparoscopic appendectomy, which is minimally invasive surgery to remove the entire appendix. In some cases, it can also be treated with a 10-day course of broad-spectrum antibiotics, though rates of recurrent appendicitis is higher in patients who don't have an appendectomy. For complicated appendicitis, the risk of sepsis is really important and usually leads to emergency surgery to remove the appendix, as well as antibiotics, sometimes intravenously.